Congenital syphilis, in case of early features, this includes in birth weight, it can be low birth weight, less than 2.5 to 2,500 grams, and looking as mucocutaneous, it can present with the snuffles. There can be presence of microbiology rash. There can be presence of pustules, mucus patches. There may be the condylomata lata as well as the vesiculous lesions. There can be presence of the ragettes and desquamation as well as presence of alopecia. These characteristics may be present. Now next looking at the laryngeal. Case of laryngeal, there can be presence of hoarse cry, and ocular it can be presented with the chorioretinitis. There can be presence of uveitis as well as glaucoma. Now looking at the GI, there can be presence of the hepatosplenomegaly as well as the pancreatitis as well as enteritis. Now looking at the renal. Renal, it can include the nephritis as well as the edema or the ascites. Now looking at lymphatics. In lymphatics, it includes the lymphadenopathy. And looking at hematological, it includes the thrombocytopenia as well as anemia and the DIC, disseminated intravascular coagulation. Now the CNS manifestation, it can be present with the aseptic meningitis, chronic microvasculature, syphilis as well as the cranial nerve palsies and the hydrocephalus. Then skeletal, it can involve the periostitis, osteochondritis, and this can cause the pseudoparalysis and as well as osteitis.